I'm a specialist in internal medicine and I have worked in the drug industry when I was young because I'm also a biologist, and I quickly realized I needed to get out of that because it wasn't the truth that they were telling people.
Here I am. My name is Mayra Floss. I'm a medical student from Brazil, and I'm here with Peter Gotzsche from Denmark. And he wrote this book, Smrtící, crime organizado. And I'd like to ask Peter to introduce yourself and talk a little bit about your work.
I'm a specialist in internal medicine and I have worked in the drug industry when I was young because I'm also a biologist. And I quickly realized I needed to get out of that because it wasn't the truth that they were telling people.
And you talk about this on this book.
Yes.
You also talk about the lies and how they work as a criminal industry. Can you comment on this?
Yeah, Pfizer has been convicted of organized crime, one of the biggest drug companies, and a conspiracy. And the other drug companies have similar business methods. So I have concluded that it is organized crime that goes on in the drug industry. And there are many other similarities to the mafia. Actually, the drug industry kills far more people than the mafia does. So in a way it's worse because people in drug companies don't care how many people die because of side effects, as long as it doesn't make too big headlines.
What can we do? What do you recommend for us to survive and make our patients to survive as well to this?
Well, everybody should take as little drugs as possible. We use far too many drugs, which is why our drugs are the third major cause of death after heart disease and cancer. Several studies have shown this. This is outrageous. We kill a lot of people with drugs that most of them even don't need. So we need to use drugs very sparingly and only when they are needed.
How can we discover it? Do you have any clue, any tip for young doctors or students that would like to get the better for the patients and do the better for a better society?
Yes, of course. People shouldn't use arthritis drugs very much. They're used for all types of pain and people believe they have an anti-inflammatory effect. This is not true. This is a marketing lie. They're just painkillers, but they also kill a lot of people. So either you should not treat the pain. Very many types of pain don't need treatment. You just need to be a little patient and then they disappear again. I never use drugs for pain, for example. And if you need a drug for pain, you can take a paracetamol. That won't kill you. So this is one very good example that these drugs kill. They have killed hundreds of thousands of people, in many cases for no good reason. Of course, it's no good reason to kill people, but they were given for no good reason.
Do you have any final recommendation for young doctors and students that will be watching it?
Yes, if you see a patient who is on many drugs, then start talking to the patient about how their life is, how they sleep, how they function in their daily life, how their sex life is, whether they are sometimes dizzy and risk falling and so on. If you start that conversation, you will often discover that there are some side effects of the drugs the patient are taking, but they never thought it could be side effects. When you then discuss these possible side effects, it's easier to make the patient agree that maybe I should try to stop some of these drugs and see if I get a better life.
Thank you so much,
You're
Peter.
welcome.
And thanks
You're
so much
welcome.
for giving your time.
Yeah, you're welcome. Okay.